The honourable member for Courtenay-Alberni, though.
Thanks, Madam Speaker. Madam Speaker, this spring the government had a chance to listen to the experts and act on the toxic drug crisis that is taking a tragic toll on our communities every day. In my riding and in the small community of Courtenay-Alberni, in the Alberni Valley, with just over 30,000 people, Madam Speaker, we lost 20 people in just the first 8 months of this year due to the toxic drug supply. These deaths were preventable, and each person has loved ones who are left to deal with the grief in the face of government failure. Madam Speaker, that is 4 times the national average. And across the country, we lost over 7,500 lives just last year. And shamefully, we have lost more than 30,000 lives since 2016. I heard the question from people who've been impacted by this crisis. They state, quote, how many lives is it going to take before there's real action, end quote. And I worry that those with the power to bring change are becoming numb to these numbers, Madam Speaker. We must never lose sight of the fact these numbers represent children, siblings, parents, partners, friends, and neighbors. And the day this House rose for the summer, the Public Health Agency of Canada released modelling forecasting the toxic drug crisis would continue its tragic path and possibly even worsen over the rest of the year. The agency predicted that we might lose as many as 2,400 Canadians, Madam Speaker. These are real lives per quarter. So while we all return to our communities for the 3 months this summer, more than 2,000 families were likely planning funerals that didn't need to happen. They didn't need to happen because last year, Health Canada's expert task force on substance use made clear recommendations on how to respond to this crisis. Those recommendations included stopping the criminalization of people who use drugs, making significant new investments in supports for people who use drugs and who are in recovery, and expand safer supply. Our bill, C-216, a health-based approach to substance use, reflected the paradigm shift the expert task force called for to stop the harm in our communities. But instead of listening to its own task force, this Liberal government teamed up with the Conservatives to vote down Bill C-216. In the face of a public health emergency, Madam Speaker, that has been worsening for years, this Liberal government is choosing an ineffective piecemeal response because of stigma and politics. But every day the government has an opportunity to make a different choice. By granting BC's decriminalization request, the government has acknowledged the harms of criminalizing people who use drugs, yet it continues to allow these harms in every other province and territory in this country. The Minister of Mental Health and Addictions has acknowledged that funding for the Substance Use and Addictions Program is not enough to meet the demand. But the government won't put enough money on the table to ensure people who can get help when they need it. The Minister has acknowledged the critical role safer supply must play in addressing this crisis. But the government remains focused on small-scale pilot projects rather than procuring a safer supply that could save lives across the country. So I ask, when will this government finally act like this is a life or death matter for thousands of Canadians each day and mount an urgent national response? When?
The Honourable Parliamentary Secretary, the Minister of Health.
Thank you, Madam Speaker. Before I start, I'd like to say thank you to my friend from Courtenay-Alberni. He's a tremendously passionate, outspoken, and dogged ambassador, advocate, and spokesperson for this cause. He knows that I respect him. He knows that I think of him, that he's doing incredible work here in the House and in his community and across the country regarding the overdose crisis. And I'm proud to be in the House with him, and I'm proud to have an opportunity to discuss this important issue here tonight. First, our hearts go out to all the families and communities that have lost loved ones to the opioid crisis and through the tainted poison drug supply that exists in our country. The Government of Canada remains deeply concerned about the devastating impact that the overdose crisis continues to have on people, families, and communities across the country, and we recognize that substance use is first and foremost a health issue. We're committed to a public health approach to substance use that is comprehensive, collaborative, and compassionate, working with our key stakeholders, including people with lived and living experiences regarding substance use, It is a foundational part of our government's work. While continuing to work with partners to look at ways to support programs, services, and to divert people who use drugs away from the criminal justice system and towards supportive and trusted relationships in health and social services, such as my colleague suggested, supervised consumption sites and safe supply. Since January 1st, 2016, the number of supervised consumption sites operating in Canada has increased from just 1 to 39. We have also funded a number of safer supply pilot projects that provide people who are at high risk of overdose with prescribed pharmaceutical-grade alternatives to the toxic and illegal drug supply on the streets. This emerging practice is a key area of interest for the Government of Canada, and evaluation efforts for these services are already underway. And indeed, there was great progress in the last 6 months in British Columbia, and due in part to advocates like my friend from Courtenay-Alberni. I want to reiterate that we have lost too many Canadians to overdose. We have heard from stakeholders that the criminalization of possession of drugs for personal use perpetuates stigma, it increases the risk of overdose and other harms, and it creates barriers to care. This government has been clear in its actions that substance use must be treated as a health issue first. Most recently, this House has sent Bill C-5 to committee for review. Among other measures, C-5 would require police and prosecutors to consider alternatives to laying charges or prosecuting individuals for drug possession, such as diversion to treatment, a warning, or to take no further action. I've spoken to police officers in my riding, Madam Speaker, specifically regarding Bill C-216 and how we can face this crisis head on with compassion and to find a solution, not just to lock people up in jail. And I will say that Halton Police Services in Milton, the ones that I spoke to, have been employing these practices on their own accord. They have strong feelings about the opioid epidemic, and it's also important to recognize that Oakville and Milton and Burlington are, in large parts, wealthy suburban communities. The opioid epidemic affects everyone. So that's why I will continue to work with provincial, territorial, and municipal partners like those in British Columbia and Vancouver and other key stakeholders and regions throughout this country to reduce risk, save lives, and get people the support they need. Canadians can be assured that combating the opioid overdose crisis remains a key priority for this government, for the Minister of Health, for myself, and I know that is true of my colleague as well. And Madam Speaker, I was proud not to be one of the people in the House to vote against my colleague's bill. I believed in it, I continue to, and I'm thrilled to be working together on it. Thank you, Madam Speaker.
The honourable member for Courtenay-Alberni.
Well, thank you, Madam Speaker, and I appreciate my colleague's speech and his sincerity, and I do appreciate that he didn't vote against my bill. I need him. We need him. The people whose families that have lost loved ones need him. The people that use substances that are looking at death every day, Madam Speaker, need him. They need this government to listen to their expert task force on substance use. As he talked about, talking to police and first responders, they all agree, they're unequivocally clear that criminalizing people who use substances is not working. Madam Speaker, they're not funding the substance use program that they've set out. They're not filling the need. They know they're oversubscribed. They admit that. They also admit the average wait time for residential treatment and understand is over 100 days on average in this country. That's even something we agree with conservatives on, Madam Speaker, is that we need to make sure that we meet people where that and give them the treatment when they need it and make sure it's on demand, Madam Speaker.
Parliamentary Secretary.
Thank you, Madam Speaker. Our government understands the urgency of the situation, and I'd say the government understands the urgency of the situation even more because of my friend and colleague from Courtenay-Alberni. We're moving fast and forward with a fact-based approach to ending this crisis. The overdose crisis is having a devastating impact on people. It's ripping the hearts out of our communities. It's hurting families and communities across Canada. We are already supporting a health-based approach to substance use at the federal level through the Canadian Drugs and Substances Strategy, which has been comprehensive, compassionate, collaborative, and evidence-based. It's the foundation for the Government of Canada's actions on the overdose crisis. We'll continue doing absolutely everything we possibly can to save lives and to end this national public health crisis. And once again, Madam Speaker, I'd like to sincerely thank my friend and colleague from Courtenay-Alberni for his work on this and many other issues. Thank you.